The medical course is quite intense.
The fact that it's such like a clear career path, we all know pretty much exactly the shape of what we're going to do for like the next 60 years, so sometimes it can feel if something's not going right, it's like, well, this is like these 5 years like define how my future is going to go, so it can be quite like intense, I think, like that.
Yeah.
I think it's the volume of stuff you're expected to do.
In the first couple of weeks it can be a bit overwhelming.
It's much more of an independent
Learning you're not spoon-fed at all.
Clinicals and trying to sort of fit in revision and everything amongst being on placement and trying to sort of balance your time.
It's a big jump from, you know, doing your GCSEs and A-levels. A lot more is demanded of you in terms of studying out.
Having fun almost becomes this like activity that you feel like you need to be doing all the time. Feeling like you have to be doing like a sport, drama and volunteering and going out every night can just make it seem like this impossible
really
list of
overwhelming.
like tasks that you have to do.
Making new friends, socialising, sport time.
Definitely think a big one is housing. First of all, housemates. It can be stressful trying to find housemates. Finding a house, everyone has different expectations of what they want.
Money and housing and making new friends and being away from home.
A lot of people feel homesick at uni.
Perhaps having to earn extra money to support yourself means having to fit a job around your course.
Like problems with boyfriends, girlfriends.
And probably like emotional sort of stresses as well, in terms of like being on like stressful placements, dealing with patients and across sad things.
You're not really taught how to be professional, and there's a jump from being, you know, just a normal student to actually, oh, okay, I'm sort of in this environment where I have to be an adult and I have to act like I'm a professional.
A lot of people seem to start to struggle with mental health issues around the age of 18, 19, 20, especially medics who've got the added stress of all the elements of their course.
I think quite a lot of people will keep it quiet and they keep it to themselves, which probably isn't the best thing to do.
There's a stigma around mental health anyway, and probably more so medical students, because, I don't know, people think it's like frowned upon.
I think it's quite easy to get into a mindset of feeling that you can't cope with the demands of you. So feelings of depression, anxiety, I think are quite prevalent, especially amongst medics.
Like, problems generally sort of seen as a bit of a weakness, when they're really not. It's a weakness when you have a problem, you don't deal with it and it gets worse.
Some people are a little bit apprehensive about opening up to people.
Everybody feels like they should be strong, so everybody pretends that they're not stressed and everybody pretends that nothing's wrong, so everybody else thinks that everyone else is fine, so nobody starts talking about it, because everybody is just like in their own little bubble of feeling like they're the only one who's falling behind, when actually like everyone feels like that.
Making sure you try and balance everything.
It's really important that you have to recognise when you do get stressed and to find someone to talk to. There's so many different people you can talk to.
Yeah.
I really enjoy doing sports, so having time to just go for a run or something to clear your head and take your mind off work.
Sleep a lot, drink a lot of tea.
We need tea, we
You
drink
drink
a lot of tea.
tea.
So much tea,
So
and
much
a
tea.
variety of tea.
Yeah, just make sure you eat veg. That's quite important.
Don't feel forced to go to crisis on a Wednesday if you really don't want to go to crisis on a Wednesday, because it won't be the best night in the world, even though you'll be told it will be.
Have some fun outside of medicine. Make sure that's not your life. You don't spend your life in the library.
It's just knowing when to call it quits
Yeah.
and saying we need a film,
Yeah,
we need some hugs.
as soon as you just say to someone like, yeah, I'm feeling really stressed right now, they're like, oh my god, I feel the same.
Fully just get engaged and enjoy it. It's going to be the best time of your life.
There are peer supporters within the med school. It's confidential. You can find people who will just sit and listen to you.
When you get here, you get given a mummy or daddy, and they're like there to kind of guide you through the first year, and then from that you have like a whole extended family.
There are counsellors within the university system.
You can also talk to the sub-deans, and they can also help you out with like anything to do with the course or any other problems.
We've also got obviously the MedSoc welfare rep, and she's like a good place to sort of like delegate you to where you need to go, because I think sometimes there's so much available but you might actually not know which is best, but there's always like someone to go to as like they can kind of guide you. I'm literally there's help like pouring out my ears.
Yeah, if you need help, there is always somewhere for you to get some.
Yeah, it's just having to have like they take that step to go and ask for it.
Yeah.
We obviously encourage the students to have this relationship with a personal tutor, because if you think in advance, it will be the personal tutor that is writing your reference for you. So building a relationship with them is quite important on both sides. But what I would like to say at this point is not all about problem solving. What we think over, I think in the School of Medicine, is that the personal tutoring system is there to support the development of the student to become the professional that we hope you all will be. So those of you who don't go and talk to the personal tutor, you're actually missing out on the developmental side, but we can help you progress, we can help you develop your reflective practice, plan goals and things like that. So you may well be missing out.
Hello, my name is Gemma and I'm the coordinator of the MedSoc support scheme. So the MedSoc support scheme is we have student volunteers from across the medical school who are there to provide a non-judgmental and supporting listening ear for anything you might want to talk about. So whether that's from friendship issues, relationship issues, right to mental health, depression, housing, family, relationships, anything you might want to talk about. Anything you want to say will be kept confidential, and all the supporters are highly trained, so you're in capable hands.
My name's Deborah Merrick. I'm an assistant professor of anatomy and senior tutor at the medical school. I've been senior tutor for a couple of years, but I've been a tutor for medical students and science students for just over 10 years.
So I think people have a preconception when they go to see the sub-deans that they're just there for things that are really serious or that will leave marks on their medical records, when actually it's not true. They're there for any issues that you're having, no matter how big or small they might be.
Yes.
And a lot of people also think they're just there for problems you're having in the course, whether it's failing exams or just generally struggling with the workload. But actually, that's also not true. It's any problems you're having outside of the course as well.
As a sub-dean, there are 4 of us. I'm a paediatrician, so I'm one of the consultants here at the Queen's, and on top of that have a significant interest in pastoral support. So I've tutored, supported students and postgraduates around medical education. And I think that's one of the key roles as a sub-dean. We merge the 2 areas, teaching and our awareness of the exam structure and the university course, together with pastoral support.